Hey everyone, Janet here. We talk a lot about staying healthy on this channel, and today we're diving into a condition that affects millions of people, many without even knowing it: fatty liver disease. Now, our liver is a pretty amazing organ. It's a multitasker, handling everything from filtering toxins to digesting fats. But when fat builds up in the liver, it can lead to inflammation and damage. The tricky part is that fatty liver disease often doesn't show obvious symptoms in its early stages, but there are some subtle signs your body might be sending that shouldn't be ignored. So in this video, we're going to break down 10 early warning signs of fatty liver disease. Remember, I'm not diagnosing anyone here. This video is for informational purposes only. If you experience any of these symptoms, it's crucial to consult a healthcare professional for proper diagnosis and treatment. Let's start with a symptom many of us experience: fatigue. Fatigue from fatty liver disease is different. It's a persistent lack of energy that doesn't improve with rest. Imagine waking up feeling unrefreshed, even after a full night's sleep. This constant fatigue impacts your quality of life. Your liver plays a crucial role in energy production. Fat buildup in the liver leads to constant exhaustion. Think about everything you do in a day. Going to work, taking care of your family, even just enjoying your hobbies. It all requires energy. When you're constantly fatigued, these everyday activities can become a real struggle. You might find yourself cancelling plans, avoiding social events, and just generally withdrawing from life because you simply don't have the energy. It's like your body is constantly running on empty. And this fatigue isn't just a physical thing, it takes a toll on your mental health too. It can lead to increased stress, anxiety, and even depression. It's like a vicious cycle. The fatigue impacts your mental health, and your mental health can worsen the fatigue. So if you're experiencing persistent, unexplained fatigue that goes beyond normal tiredness and doesn't improve with rest, it's absolutely essential to talk to your doctor. They can help determine the underlying cause and recommend the right course of action. Moving on to another early warning sign of fatty liver disease: upper abdominal pain. Fatty liver disease pain is often in the upper right abdomen where the liver is. It can be dull or sharp, constant or intermittent. As fat builds up, the liver enlarges, causing pressure and pain. This pressure feels like wearing a tight shirt. Now, while this pain can be mild at first, it's important not to ignore it. Over time, as the condition progresses, the pain can become more severe and more frequent. Think about it. If your liver is constantly inflamed and enlarged, it's going to cause ongoing discomfort and pain. It can make it difficult to sleep, eat properly, or even just relax. And here's the thing, that pain in your upper abdomen isn't always the only symptom. It can be accompanied by other digestive issues like bloating, nausea, or a feeling of fullness even after eating a small meal. So, if you're experiencing persistent or recurring pain in your upper right abdomen, especially if it's accompanied by other digestive symptoms, don't brush it off. Get it checked out by a healthcare professional. Early detection and treatment are key when it comes to managing fatty liver disease and preventing further complications. Hey everyone, Janet here. Loss of appetite can be an early warning sign of fatty liver disease. It's not just about skipping meals, it's a persistent decrease in your desire to eat. Your liver plays a vital role in digestion. When it's struggling, your digestive process can be thrown off. This can lead to feeling full quickly and unintentional weight loss. Talk to your doctor if you notice a persistent decrease in appetite. Loss of appetite often comes with nausea and abdominal pain. This makes maintaining a healthy diet challenging. Consult your doctor or dietitian for a personalized meal plan. Focus on nutrient-dense foods and smaller, frequent meals. Early detection and management are key. Don't ignore changes in eating habits. Talk to your doctor. We all know that maintaining a healthy weight is crucial, but what about unexplained weight loss? While it might seem like a welcome change, it can actually be a red flag, especially when it comes to fatty liver disease. This isn't about intentionally shedding pounds through diet and exercise. We're talking about unintentional weight loss, a gradual decline in your weight without any significant changes to your lifestyle. This can be a sign that your liver isn't functioning optimally. When your liver is affected by fatty liver disease, its ability to metabolize nutrients effectively can be compromised. This means your body might not be absorbing the calories and nutrients from your food as it should, leading to weight loss. Now, this unintentional weight loss often goes hand in hand with other symptoms we've discussed, like loss of appetite, nausea, and abdominal pain. Unexplained weight loss is a signal that something might be off. Talk to your doctor to determine the cause. Early detection is crucial for managing conditions like fatty liver disease. Addressing the root cause often involves lifestyle changes. Prioritize your overall health and well-being. We've all experienced feeling tired or run down, but what about persistent weakness? This isn't just about needing an extra cup of coffee. We're talking about a lingering lack of energy and strength that affects your ability to perform daily tasks. Weakness is another early warning sign of fatty liver disease that often gets overlooked. Your liver plays a vital role in converting food into energy your body can use. When your liver is compromised, this process can be disrupted, leading to feelings of fatigue and weakness. It's important to recognize that persistent weakness, especially when accompanied by other symptoms like those we've discussed, is not normal. It's your body's way of telling you something's not quite right. If you're feeling constantly drained and lack the energy to do the things you enjoy, don't ignore it. Talk to your doctor. They can help determine the underlying cause of your weakness and rule out any other potential medical conditions. In many cases, addressing the underlying liver issue can significantly improve energy levels and reduce feelings of weakness. This often involves lifestyle modifications, such as adopting a balanced diet, engaging in regular physical activity, and avoiding alcohol. Remember, your body is constantly communicating with you. Pay attention to its signals and don't hesitate to seek medical advice when needed. Early detection and management are key to protecting your liver health and overall well-being. Hey everyone, Janet here. We're talking about nausea, an early warning sign of fatty liver disease. Persistent nausea could mean your liver is struggling. Your liver detoxifies your body, but too much fat hinders this. This can lead to toxin buildup, causing nausea. What does my liver have to do with my digestion? It plays a crucial role. Your liver produces bile to break down fats. Fatty liver disease can obstruct bile flow. This disrupts digestion, causing nausea. It's like a traffic jam in your system. Early detection is key. Catch it early to reverse damage. Persistent nausea? Talk to your doctor. They can check your liver health. All right, let's talk about something we all do, something we might not think twice about. Pee. Yes, you heard me right. The color of your urine can actually tell you a lot about your health, especially when it comes to your liver. Now, we all know what color our pee should be, a nice pale yellow. But when your urine starts to look darker, like the color of cola or strong tea, it could be a sign that something's off with your liver. See, your liver is responsible for breaking down a substance called bilirubin. Bilirubin is a yellow pigment that's produced when red blood cells break down. A healthy liver usually processes bilirubin efficiently, but a fatty liver might not be able to keep up. When bilirubin builds up in your bloodstream, it can make its way into your urine, turning it that dark, brownish color. Now, I know it might feel awkward to talk about pee, but trust me, it's important. Your doctor needs all the information they can get to diagnose and treat you properly. So next time you're in the bathroom, take a quick glance. Remember, dark urine by itself doesn't always mean you have fatty liver disease. It could be caused by dehydration, certain medications, or other medical conditions. But if you're noticing dark urine along with other symptoms like fatigue, abdominal pain, or jaundice, it's definitely time to schedule a visit with your doctor. Early detection is key when it comes to liver health. The sooner you catch any potential problems, the better your chances of preventing serious complications down the line. So don't be shy, talk to your doctor and stay informed about your health. Okay, I know we're getting up close and personal with our bodies in this video, but trust me, it's all in the name of health. Pale stool can be an early warning sign of fatty liver disease. The color of your stool reveals a lot about your liver and digestive health. Bile, produced by the liver, gives stool its brown color. In fatty liver disease, bile production is affected. This results in lighter colored stool. Think pale yellow, clay-colored, or white. It's important to be aware of these changes. Now, just like with dark urine, pale stool by itself doesn't always mean you have fatty liver disease. It could be caused by other factors like certain medications, dietary changes, or other digestive issues. However, if you're noticing persistent pale stool, especially if it's accompanied by other symptoms like dark urine, jaundice, abdominal pain, or fatigue, it's crucial to talk to your doctor. They can help determine the underlying cause of your pale stool and recommend the appropriate course of action. Remember, early detection is key when it comes to liver health. Don't ignore the signs your body is sending you. So be proactive about your health, pay attention to your body, and don't hesitate to reach out to your doctor if you have any concerns. Your liver will thank you for it. Hey everyone, Janet here. We're continuing our discussion about fatty liver disease. And in this chapter, we're going to talk about a really important warning sign, jaundice. Now, you might have heard of jaundice before, maybe in newborns. It's what gives the skin and eyes a yellowish tint. But jaundice isn't just a newborn thing, and it can definitely happen in adults, often signaling a problem with the liver. Jaundice happens when a substance called bilirubin builds up in your blood. Bilirubin is a yellow pigment that's naturally produced when old red blood cells break down. A healthy liver usually filters out this bilirubin and sends it out of the body. But when your liver is damaged, like from fatty liver disease, it can't remove bilirubin as efficiently. This buildup of bilirubin is what causes the yellowing of your skin and eyes. Now, jaundice itself isn't painful, but it's a major red flag that something is off with your liver. It's often a sign that the damage is progressing. If you notice even a slight yellowing of your skin or the whites of your eyes, don't ignore it. It's crucial to see your doctor right away. They can run tests to check your bilirubin levels and determine the cause of the jaundice. Remember, early detection is key when it comes to treating liver disease. The sooner you catch it, the better the chances of slowing down its progression and preventing further damage. So keep an eye out for jaundice, guys. It's not something to take lightly. In the next chapter, we'll discuss another potential symptom of fatty liver disease, mild brain impairment. Welcome back, everyone. We're talking about the early warning signs of fatty liver disease, and in this chapter we're diving into a symptom you might not expect, mild brain impairment. Now you might be thinking, wait, my liver? What does that have to do with my brain? Believe it or not, these two organs are closely connected. You see, the liver acts like the body's filter, removing toxins from the bloodstream. But when the liver is damaged, like with fatty liver disease, it can't do its job as effectively. This can allow toxins to build up in the blood, and guess what? Those toxins can eventually reach the brain. When toxins reach the brain, they can interfere with its normal function. Now, in the early stages of fatty liver disease, the brain-related symptoms are usually mild. You might experience things like difficulty concentrating, feeling forgetful, or having trouble remembering things. You might find it harder to focus on tasks, make decisions, or follow conversations. These symptoms can be subtle at first, and you might brush them off as just being tired or stressed. But if you notice these cognitive changes, especially if they're persistent, it's essential to talk to your doctor. Remember, early diagnosis and treatment of fatty liver disease is crucial for protecting your brain health. Your doctor can assess your symptoms, run the necessary tests, and help you manage the condition effectively. So, pay attention to your cognitive health, guys. It's another important piece of the puzzle when it comes to fatty liver disease. So there you have it, guys. We've covered 10 important early warning signs of fatty liver disease. From fatigue and abdominal pain to jaundice, and even mild brain impairment, it's clear that this condition can impact your body in many ways. Remember, early detection is key when it comes to managing fatty liver disease. If you're experiencing any of the symptoms we've discussed, Don't hesitate to reach out to your healthcare provider. They can provide a proper diagnosis and create a personalized treatment plan that's right for you. Thanks for watching. If you found this video helpful, please give it a thumbs up, share it with your friends and family, and subscribe to our channel for more informative health content. And remember, taking care of your liver is essential for a long and healthy life.